Blood oxygen level dependent MRI in prostate. Today I'm going to present bold MRI sequence in prostate as regards a brief introduction, T2 acquisition, source of contrast, factors affecting R2 star value. Vasomodulation technique, advantages of bold in prostate, and some cases from literature and our work in progress. Hypoxia is known to be prognostic marker for a poor treatment outcome with radiotherapy, chemotherapy, and surgery in solid tumors. Tumor hypoxia can be evaluated using either polarographic needle electrode or tissue immunohistochemistry, but this is invasive. Prostate cancer is the second most commonly diagnosed malignancy and is the fifth leading cause of cancer-related mortality in males all over the world. And thus, non-invasive imaging tools for identifying the regional distribution of hypoxia in prostatic tumors show potential for selecting an appropriate treatment strategy. BOLD is a functional MRI promising technique that might offer some information on hypoxia in a non-invasive manner. It involves the use of a T2 gradient echo with multi-echo sequence. It distinguishes oxygenated from hypoxic tissue through measurement of tissue paramagnetic deoxyhemoglobin. This effect is detected by acquiring spin-spin relaxation T2 star measurements. The T2 star is measured by fitting an exponential function to the multi-echo data with respect to the echo time. How is T2 is acquired? What influences T2? T2 relaxation comes about when protons got out of phase, which as we already know, has two causes, either inhomogeneities of the external magnetic field and inhomogeneities of the local magnetic field within the tissues. As water molecules move around very fast, the local magnetic fields fluctuate fast and therefore kind of average each other out. So there are no big net difference in internal magnetic fields from place to place. And if there is no big difference in magnetic field strength within a tissue, the protons stay in state for a long time before they dephase, and so T2 is longer. With impure liquids such as those containing larger molecules, there will be a bigger variation in the magnetic fields. Why? Because the larger molecules do not move very fast, so the local magnetic fields do not cancel each other out as much. These larger differences in local magnetic fields consequently cause larger differences in precessing frequencies. Thus, protons get out of phase faster and T2 is shorter. This can be illustrated by this example. Imagine that you drive your car down a street that contains so many potholes. If you drive slowly, you will feel each pothole separately, and the car will bump up and down over each pothole. So you will be influenced by the surroundings, which is the potholes, and we mean by it the magnetic field variations. But if you drive very fast, you will not feel these potholes anymore. These potholes will not affect you before you come out of these potholes to the normal street. And thus, you are much less influenced by the differences in the surroundings, and all these processes influence how your MRI image will finally look. Thus, the echo time must be sufficiently short to maintain signal and must be sufficiently long to have the bold sensitivity, and this is called the T2 star. And then R2 star, which is the bold effect itself, can be quantified by plotting the natural log of signal intensity against the echo time. So R2 star is 1 divided by T2 star. In bold sequence, we do not give the patient exogenous contrast material, but the primary source is the endogenous paramagnetic deoxyhemoglobin, which increases the MR transverse relaxation rate of water in the blood and surrounding tissues. Thus, bold MRI is sensitive to paramagnetic deoxyhemoglobin within and in tissues adjacent to the perfused vessels. So, as we mentioned, the bold method uses the oxygen levels in the blood to measure the degree of tissue oxygenation, but how this exactly works? The magnetic susceptibility of hemoglobin is dependent on oxygen levels, where hemoglobin with plenty of oxygen, the oxygenated hemoglobin, is biomagnetic. This means it is repelled by the magnetic field. Whereas hemoglobin, depleted oxygen, referred to the deoxyhemoglobin, is the paramagnetic deoxyhemoglobin. This means that it will be attracted by the magnetic field. So to sum up, high R2 star value will denote high concentration of the deoxyhemoglobin in tissues and relatively low concentration of oxygenation in tissues. This is an example from the literature. Here we can see transverse T2 image showing a lesion 1.7 centimeter in the transition zone. This is the ADC, the lesion is restricted. And this is the T2 image and its corresponding R2 star image, colored map. They put a row on the lesion and another row on the normal transition zone and another row on the normal peripheral zone. The values of the R2 star was 31 at the lesion, 19.8 at the normal peripheral zone, and 22.2 at the normal transition zone. So there is significant difference between the lesion R2 star value and the normal prostatic tissue. Many researches about the bold effect in prostate, the false positive and false negative results, was explained by that the R2 star value is affected by multiple factors, such as in a tumor with neoangiogenesis, there is increased blood flow and volume and thus increased oxygenation and decreased R2 star. Another explanation was that in post-biopsy hemorrhage, there is affection of the field homogeneity leading to elevated R2 star. Another factors include transverse relaxation parameters, iron content, fibrosis, blood volume fraction, blood flow as we already explained, and macroscopic field inhomogeneity that can be caused by hemorrhage. In many bold MRI experiments, MRI sequences are performed before and after an oxygen challenge. The hyperoxic effect upon the hypoxic tissues show minimal change in degree of oxygenated hemoglobin, whereas its effect on the normoxic tissue vasculature is associated with increased oxygenated hemoglobin. This graph shows the red dashed curve shows increased T2 measurement in normoxic tissue after an oxygen challenge, and the blue dashed curve is the T2 measurement in hyperoxic tissue after an oxygen challenge. But vasomodulation in bold is not recommended. Why? Because vasomodulation induced hyperoxia leads to induced hypertension and systemic vasoconstriction. If the tumor contains immature vessels, there will be increased perfusion leading to increased oxygenation and artifactually decreased R2 star due to inflow effect. But if the tumor is containing vessels with good vascular tone, this will lead to decreased perfusion and thus reduced inflow effect and increased R2 star measure. Advantages of bold is either diagnostic to differentiate between malignant and benign tissues, and this will help in the ambiguity of PIRADS 3 category lesion. Or if the tumor is already diagnosed as malignant, it can differentiate normoxic from hypoxic tissue within the tumor, which can change the treatment strategy in oncology because a lower dose of radiation will likely be used for normoxic tissue relative to hypoxic tissue within a tumor. This is an example from our case in our work in progress. This is a 71-year-old male patient. Here is the axial T2 image showing that the prostate is infiltrated with homogeneous moderate T2 hypointense mass with extraprostatic extension invading the periprostatic fat and invading the seminal vesicles. Here is the diffusion and ADC map showing restricted diffusion with ADC value of 0.4. This is the T2 star and R2 star colored map. The value of the R2 star was 34. And this lesion was proved by histopathology to be adenocarcinoma, Gleason score 5+5, and grade group 5 with extraprostatic fat invasion shown here. This is another example from our work. The T2 axial cut images show a category PIRADS 3 category lesion in the right peripheral zone. there is a hypointense patch. By diffusion and ADC, it is restricted with ADC value 0.6, and R2 star value was 20, which is significantly lower from the previous case, which was proved to be adenocarcinoma, and this case was proved to be prostatitis. And well, there is a significant difference between the values of malignant and benign lesions by R2 star value. Thank you.